Welcome, my dear friends. I welcome you all. Myself is Professor Dr. Rajendra Raghuvir Deshpande, and today this particular video is regarding the रसशास्त्र भैषज्य कल्पना सिलेबस। जो अभ्यासक्रम रहता है सेकंड ईयर बीएमएस स्टूडेंट जो होंगे, उन पढ़ाई करते समय आप पहले ध्यान में रखिए कि आपके सिलेबस के हर एक पॉइंट की जानकारी आपको होनी चाहिए। इसलिए ये सिलेबस अभ्यासक्रम सेकंड ईयर बीएमएस रसशास्त्र भैषज्य कल्पना का सिलेबस, उसके पॉइंट्स हम आज देखने वाले हैं। मैं प्राध्यापक डॉक्टर राजेंद्र रघुवीर देशपांडे। I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. My WhatsApp number is 922681060. Rasashastra is a very important topic in our medical practice because बहुत सारे वनस्पति या जो सिंगल हर्बल टैबलेट्स हैं वो जरूर हम इस्तेमाल करते हैं, उसका उपयोग भी है। फिलहाल जब हम सुतशेखर, आरोग्यवर्धिनी, बृहत्वात चिंतामणि ऐसे कुछ पारद और सल्फर गंधक इससे मिले जुले जो प्रोडक्ट्स रहते हैं, उनकी जब हम इस्तेमाल करना चालू करेंगे तो आपकी प्रैक्टिस बहुत सारी बढ़ जाएगी, क्योंकि उसकी जो पावर है, रसशास्त्र औषधि, रसशास्त्र जो मेडिसिन है, हर्बो मिनरल प्रोडक्ट्स की जो पावर शक्ति रहती है वो कितने गुना ज्यादा वनस्पति से रहती है। क्विक रिजल्ट्स आ जाते हैं, शेल्फ लाइफ वो टिकाऊ ज्यादा रहते हैं। तो इसलिए इसका जो सिलेबस है वो बहुत महत्वपूर्ण है। तो पर्पज ऑफ दिस पीपीटी, दिस सिलेबस इज chalked out by the CCM, Central Council of Indian Medicine, in 2012. Okay, so purpose of this syllabus is to students should recite this particular syllabus and to keep their eye what is my target in the examination, what is my target in my practice. So theory, there are two papers, total marks 200, practicals is also of 200 marks. Okay, so first part, paper 1 part A, basically you will have to learn the definition and etymology of rasa, history of rasashastra, and importance of rasaushadhi, concept of rasa and rasayana, concept of raseshwara darshana, that is philosophy, concept of rasashala as per the GMP norm. Okay, part paper 1 part A, brief description and application of technical terminologies, जैसे कि आवाप मतलब क्या है, निर्वाप क्या है, ढालन क्या है, भावना, जारण, मूर्छना, शोधन, मारण, अमृतिकरण, ये सब टर्म्स आपको याद होनी चाहिए, उसकी जानकारी होनी चाहिए। क्योंकि अभी मेडिकल फील्ड में हम बोलते हैं कि हर्बो मिनरल प्रोडक्ट्स आर वेरी वेरी यूजफुल, बट देयर आर मेनी ऑब्जेक्शंस by the modern fraternity and even sometimes common man. They feel that these particular metals that you are using, gold, silver, copper, etc., in Ayurveda, that can be hepatotoxic, nephrotoxic, but that is a total misunderstanding, because whatever the purificatory processes that we are doing for purifying these metals and preparing the basma, this is totally remove that crude sense of that particular metal, and those particles are converted to the nanoparticles. Okay, paper 1 part A, there are dravya vargas like amala varga, panchamrutika, panchagavya, this is very important, cows ghee, cows milk, etc., panchagavya, panchamruta, ksharashtaka, and lavana panchak, that you know very well, sendha rehta hai, savarchal rehta hai. So salts, types of the salts. Okay, brief description of yantra, various the instruments that are using. For example, ulukhala yantra, khalva yantra, you know that khalva yantra for trituration. Then kachapa yantra, damaru yantra, okay, vidyadhara yantra, urdhva patana yantra, adhap patana, and tiryak patana, distillation apparatus. So all these apparatus are very useful because they will be asked in your examination. Yantra, dola yantra, patala yantra, palika yantra, and baluka yantra, different types of svedana yantra. Then there is a brief description and application of musha. Musha means crucible, and that is samanya musha, gostani musha, vajra musha, mahamusha, yoga musha, vrintaka musha, mal or pakva musha. So this is also important for your examination purpose. Crucible, which type of, when you prepare the medicines, you use these particular bottles. Okay, so silica crucible and platinum crucible, mudra and sandhi bandhana. Next, paper 1 part A, brief description and application of chillika, furnaces, Satvapatana Koshti, Patala Koshti, Gara Koshti, Angara Koshti, and the latest instruments like gas stove, hot plate, heating mantle, inducing stove, and hot air oven. Paper 1 part A, concept, definition, and types of Putta. Surya Putta, Chandra Putta, okay, Lava Puttaka, Kukkuta Putta, Gajaputta, and Mahaputta. What is Putta? Putta is giving the fire, Agni. Agni processing is called as Putta. Agni processing is called as a Putta. For example, Praval is available Chandra Putti Praval Bhasma and Surya Putti Praval Bhasma. So Surya Putti Praval Bhasma is basically useful for the indigestion purpose. And Chandra Putti, cooling, drying of that Praval Bhasma in the moonlight. Surya Putti giving the heat. So there is a difference in the results. Chandra Putti is very good for the in hyperacidity due to the gastritis with alcohol, with the drugs. Then you can use the Chandra Putti Praval Bhasma. Okay, Putta, Kumbha Putta, Aluka Putta, and latest application of electric muffle furnace and fuel diesel dependent furnaces. Brief introduction of thermocouple and pyrometer. Paper 1 part A, knowledge of Parad, synonyms, occurrence, then Hingulotha Parad. What is Hingulotha Parad? Then Parad Dosh, they are always asked in the examination. Naisargika Dosha, Yaugika Dosha, and Kanchuka Dosha of Parada. Okay, Parada Gati, it is also very important. Parada Sanskar, 101%. Each question paper will ask this question, Parada Sanskar. So you must have this topic very, very clear. Then Ashta Sanskar are more important. Then preparation concept of Murchana and Jarana of Parada. Parada is a mercury. Preparation of Kajjali. You know, Kajjali, union of the mercury and sulfur. Kajjali is a liquid form. Okay. Classification of Rasaushadhi. Khalvi Rasa. Example is Tribhuvana Kirti Rasa, which is the best drug for the fever. Vata Kafaja Jvara. Even in the corona that we can use as a supportive medicine. Then Parpati, Rasa Parpati. Kupipakva Rasayan. For example, Rasa Sindur. Pottali Rasa, Hema Garbha Pottali. This is our best emergency medicine in Ayurveda. Hema Garbha Pottali. When your BP is not recordable, your pulse is very, very low, patient is dying, then you can use a chartana of Hema Garbha Rasa. Okay. Paper 1 part A, brief introduction and quality control, standardization. This is the very important in nowadays. When you go for the service of doing in R&D, research and development, you must know that what is the good medical practice, or rather pharmacy, good medical pharmacy of Rasa Ushadhi, GMP norms. GMP. This is the coin of today's world. Okay. What you know about Rasa Ushadhi? For example, Shodhana, Marana, and other processing techniques. What do you know about Rasa Ushadhi? Then Apakva and Avidhi, Sevanjana Dosha. If you take this particular Rasa Ushadhi in inappropriate doses, in a wrong method, then that can make you harm than the benefits. So Rasa Ushadhi are very delicate. They are very, very useful, and they also can make a harm to your body if the proper Shodhana is not done. So whenever you purchase Sutta Shekhar, then Ekanga Viraras, Bruhatva Chintamani, you always purchase these mineral products from the standard Ayurvedic companies like Baidyanath. Maharasa, Abra, Vaikranta, Makshika, Vimala, Shilajatu, Sasyaka, Chapala, and Rasaka. You must remember all these names by heart. Perfect. Because every time Abrak is asked for your examination, then Vaikrant is asked. Shilajatu is the best rasayan for Medoroga and Prameha and kidney. So Shilajatu is very good. Then some medicines are not available in the market. You must know about which medicines are unavailable in the market. Uparasa, Gandhaka, Gairika, Kasisa, Kankshi, Haratal, Manashila, Anjana, and Kankushta. So you must remember all these names. Gandhaka, Gairika, Kasisa. Kasisa Bhasma is very useful for anemia. Harta and Manashil, they are like poisons. Red arsenic and yellow arsenic. But we are making purification, and they are best Kafagna. When there is a pneumonitis, lot of bronchiectasis cough, then we use the Harta and Manashil. Then Sadharan Rasa, Kampillaka, Gauri Pashana, Navasagara. Then Kapardika, Agnijara, Girisundura, Hingula, and Mruddar Shunga. Mruddar Shrunga. Actually, this is the what you can say, the litharge is called as a Mruddar Shrunga. Okay. Dhatu. Which dhatu we use in the medicines? Swarna, Rajata, Tamra, Loha, Vanga, and Naga. Naga and Vanga, tin and lead, very useful. Yasada, Jinka, Kansya, bronze, Pitala, brass. So all this information you will get in the Shastra. Then Ratna and Uparatna, Manikya, Mukta. Mukta Vati is very famous from the Ramdev Baba. And Mukta Vati I have used a lot of times for treating the hypertension. Praval is the best medicine, antacid in Ayurveda, best antacid. Tarksha, that is emerald. Then what is topaz? Vajra, that is diamond. Nilama, Gomeda, and Vaidurya. These are all Ratnas you have to study. Uparatnas, Vaikrant, Suryakant, Chandrakant, Rajavarta, then Peroj, then saffron quartz, and all these Uparatnas you have to study. Sudharasa, Sudha is a limestone, then Kaparda, Shukti, Shankha, Mrugashranga, okay? All these Sudha Varga you have to study. Then Shikata Varga, Shikata means silica, Dugdha Pashana, okay? Then what is that? Akik, agate is also you have to study. All these Sikata Varga, calcium carbonates, you have to study in a very good manner. Then Kshara Varga, Sarjik Kshar, Yavak Kshar, Tankana Bhasma, best expectorant, okay? And Surya Kshar, potassium nitrate. Miscellaneous, Mandura Bola and Kasturi, Sarjarasa, all these you have to study in Rasashastra. Visha and Upavisha, this is very important. Ayurveda can use some toxic material by good purification. So Shodhana and antidote you must remember. Visha and Upavisha, Vatsanabha, these are some of the examples which we are going to study in Rasashastra. Kutsala, Jaipal, Dhattur, Bhanga, Gunja, Araka, Langali, Karavir, Ahifen, all these are the toxic, but we are using very trickfully and we are getting benefit out of it. Aushadhi Yoga ingredients, okay? This is now Bhaishajya, Arogya Vardhini, Kasturi Bhairav Ras, Kumar Kalyan Ras, Garbhapal Ras, best medicine for pregnancy. Chandra Prabhavati, best medicine for diabetes and urinary tract. Chandra Mrita Ras, okay? Aushadhi Yoga. What is that? Ananda Bhairav Ras, Yogendra Ras, Lakshmi Vilas Ras. One is more than another. Is very, very excellent drugs. Aushadhi Yoga, Vasanta Kusumakar, best tonic for chronic diabetes. Vasanta Malati Ras, Suvarna Malini, Madhumalini Vasanta, best drugs for respiratory tract as a tonic. Bhratvat Chintamani, best drug for Vata disorders. Shankhavati for the abdominal gas complaint. Shvasa Kuthar Ras for bronchial asthma. Hinguleshwar Ras, Hemagarbha Pottali for emergency. Then Hridayarnava Ras for heart. Suvarna Vanga Makaradhvaja, sex tonic. Then Puttapak. Then Jwarantaka Loha, okay? Different medicines. Kamaduda, Laghusuta Shekhar, Navayas Loha, Saptamrita Loha, Tamra Parpati, Panchamrita Parpati. Parpati Kalpas are very good for colitis, okay? Pharmacovigilance, this is the new topic. You must remember how the drugs are prepared, how they are manufactured, how they are given to the patient. Nurses are doing their job well or not. Are there any side effects? Are there any complications after using this particular drug? That is called as pharmacovigilance. Vigilance is a keen observation of dispensing the medicines. Okay. Practicals, minimum 25 to be performed. Samanya Shodhana of Parad and Kajjal you have to prepare. Shodhana of Abrak, Shodhana of Makshik, Shodhana of Shilajatu. Practicals, Uparasa Varga, Shodhana of Dandak, Shodhana, purification of Gairik, Kasis, Harta, Manashya. Practicals, Sadharan Rasa Varga, Shodhana of Hingul, Shodhana of Kapardik. Practical Sudha Varga, Shodhana of Shankha, Shodhana of Shukti, Shodhana of Prava, Shodhana of Godanti. Dhatu Varga, Samanya Shodhana of Lava. My dear friends, very interesting. Please visit my Ayurveda Academy channel and see the playlist. There I have given all these interesting videos for you. Which interesting videos? How to prepare the different types of medicines and what are the therapeutic uses of this particular medicine. Very interesting videos are there on my channel Ayurveda Academy, Professor Dr. R.R. Deshpande. Okay, Shodhana of Naga, Vanga and Yashada, Shodhana of Tankana, Parpati. You have to learn how to prepare the Rasa Parpati, Bola Parpati, Shweta Parpati, Visha Shodhan of Vatsana, Ballatak, Dattur, Jaypa, Gunja. Practicals, Hingurutha, what you can say, the Parad, Bhasmas, one from each group, Abrak Bhasmas, Swarna Makshit. It is only for demonstration purpose. Mandura Bhasma, Shankha Bhasma, etc. Pishti, Praval Pishti, Akik Pishti, Trindakanta Mukta Pishti, etc. So these are all only demonstration purpose. You don't have to do for yourself. Your teacher will show some videos or show some practicals how they are prepared. Rasa Sindur, Swarna Varga, Saptamrita Loha, Punarnava Mandur, etc. All these are the demonstrations. Arogyavardhini Vati, Laghumalini Vasant, Inguleshwara. So all these were shown to you. Now Bhaishajya Kalpana paper 2. Rasashastra is paper 1. Bhaishajya Kalpana paper 2. Rasashastra is Ayurvedic pharmacology and Bhaishajya Kalpana Ayurveda pharmacy. There is also pharmacy, but concerned with the only metals and the mercury sulfur. But here also plants are used to prepare the different formulations. Fundamental principles of Bhaishajya Kalpana, how to prepare medicine. Bhaishajya medicine, Kalpana preparation, how to prepare medicines. Okay, Man, units of measurement. You must know gram, milligram, and Ayurvedic style also. Gunja, what is Tola, Gunja, etc. Then collection and storage, how to preserve the Aushadhi Dravyas, what is the shelf life, expiry date is also there for Ayurvedic medicines. Don't forget it. Shelf life means expiry date. Churnas are always disintegrated fast and lose their capacity after 3 months, maximum 6 months. Then Rasaushadhi can be kept for a longer time, say for 2 years, 3 years. Aswas and Aristas are older, better. Older is a better. Medicated ghee, older is a better. Okay. Then what else there? Aushadha Sevan Kal. Always important question for your examination. Posology. Tell me the like 2 times in a day, 3 times in a day, before meal, after food, empty stomach, etc. Then you have to learn Panchavidha Kashaya Kalpana, home remedies. Swarasa, fresh juice. Kalka, paste, chutney. Kwath, decoction. Hima, cold infusion. Fant, hot infusion. Okay. Then Panchavidha Kashaya Kalpana extended Tandulodak and Panak, etc. Then Rasakriya, Ghana, Avaleha. Avaleha is a jam. Chavan Prashavaleha, famous. Guggulu Kalpana, Triphala Guggul, Yogaraj Guggul. Vati and Guti means tablets in Ayurveda. Okay. Mashi Kalpana, you have to ash. Mashi means ash. You have to burn that particular avala powder on the frying pan, and that black, whatever the collected, is called as the mashi. Kshara Sutra, this is very important for fistula in ano. This is a surgical problem, but this when you use this Kshara Sutra, it is a chemical cautery. Okay, instruments, disintegrator, mixer, grinder, end runner, edge runner, tableting machine, okay, polishing pan, capsule filling machine, sieves and meshes. Sneha Kalpana, Sneha Murchana Vidhi, and Sneha Siddhi Lakshana. When I say that medicated oil is formed, medicated ghee is ready to use, that you must know. That is called as a Siddhi Kalpana, last turning point. Then Trifala Ghrita, dose, preparation and uses, Brahmi Ghrita, Narayana Taila, Anu Taila. Okay. Then Aswas and Aristas, medicated liquor, medicated wine. Okay. Next is what is that? Sadhana Kalpana and its types. Takra Arishta, Draksha Arishta, very good tonic. Ashoka Arishta for feminine problems. Dashamula Arishta, best for all types of pain, Vata pain. Kumariyaso, liver tonic. Chandanaso, cooling. Okay. So types of Yavagu, Manda, Peya, Vilepi. What is that? It is a dietary processes. Manda, Peya and Vilepi. You have to, for example, you have to cook the rice. And only rice water. That is called as a Manda. A little bit rice, Peya. More rice grains and little water, Vilepi. And Yusha is always prepared from the grams, that is pulses, green gram. Moog soup, that is Yusha Kalpana. Yavagu is always from rice, Yush is from the pulses. Okay. Then Aushadhi Siddha, Anna Kalpana, Dadhi and Takra Varga. You have to study all types of the Dadhi and Takra Prayoga. Then part 2, paper 2, part B, you have to learn about Lepa, how to make the paste of a particular plant. Udvartana, dry powder massage, Udvartana. Okay. Then external application of the paste. Sarja Rasa Malahar. Okay, Gandhak Malahar, antiseptic. Whenever there is a wound, you can apply Gandhak Malahar. Atasi Upanah, to reduce the cough from the chest. You have to band a potis. Potis is Upanah. Potis, Atasi Upanah. Shat Dhauta Ghrita, medicated ghee for the application at the sole. When there is a fissures on palm and sole, when there is a burning of the sole, apply Shata Dhauta Ghrita. So you have to learn different ointments, creams, emulsions, gels and lotions. Paper 2 part B, Ashchotana, all the eye preparations. Tarpana, Puttapak, methods of preparation of eye drops and eye ointments. Okay, then what is that? Classification of Nasya, medicated, putting the oil in the nose. Navana Nasya, there are different types of the Nasya, means putting the medicine in the nose is called as a Nasya in Ayurveda. Pradhamana Nasya, powder, sprinkling of powder. Okay, then Dhuma Path, fumigation. Ayurvedic herbal smoking is not without tobacco. Without tobacco, that is dhuma pan, dhupana. Dhupana is a fumigation. Okay, vrana dhupana, arsha dhupana. For the piles, for the infected wounds, we get the fumigation treatment. Then mukha prayogartha kalpana, gandush. Taking the water, taking the milk and moving it, it's called as a kavala. And you cannot move that much big amount, that is Gandusha. Toothpaste, tooth powders, mouthwash, Basti Kalpana, Ayurvedic medicated enema. How you have to give the Niruha Basti, decoction enema. Anuvasana Basti, only oil enema. Okay, paper 2 part B, brief knowledge about standardization of Ayurvedic formulation. Drug and Cosmetic Act 1940. This is always asked in the examination. Drug and Cosmetic Act 1940 and rules 1945. Concept of Aushadhi Nirmana Shala with respect to good manufacturing practices. GMP is very important nowadays in accordance to Schedule T. Okay. Then Bhaishajya Kalpana practicals, Swarasa Kalpana, Ardrak Swaras, ginger, Tulasi Swaras, basilicum, Kumari aloe vera, Vasa, Adatoda Vasika, Puttapak, Nimbakalk, okay, Rasona Kalk, garlic, Kwat, Punarnavashtakvat, Rasna Saptakvat, Kulakthakvat for stones, Hima, Dhanyaka Hima, dry coriander, Sariva Hima, Fant, Panchakola Fant, Yashtimadu Fant, Pramathya, then Kharjuradi Manth, Kharjura, dates, then Aushadhi Siddha Prayog, Shadanga Paniya, Musta Parpat Ushira Chandana Nagarihi, Shrutam Shitam Jalam Deyam, Pipasa Jvarashantaye, Shadango Dak, Udaka means water, medicated water in the fever, medicated water for the excessive thirst in the fever, Shadanga Udaka, don't forget it, Araka, extract, Mishreya Araka, then Panaka, Chinsa Panak, tamarind, Chandana, sandalwood, Sharkara, Nimbu Sharbat, Churna, Sitopaladi Churna, best for cough, Hingvashtak Churna, best for indigestion, Gutika, Chitrakadi Gutika, Sanjivani Guti, Trifala Gugul, Kaishar Gugul, Chavan Prash, Vasavalaya, Guduchi Ghana, Kutaja Ghana, okay, then Narikela Khanda, Trifala Mashi, Mayurapicha Mashi, Shirapak, Arjun medicated milk with Arjun is the best heart tonic, Arjun Shirapak. Rasona Shirapak, best tonic for indigestion and cough. Shunthi Shirapak, ginger. Rasona is a garlic. Kshar, Apamarga Kshar, Snuhik Kshar, Mudgayusha, green gram soup. Green gram soup, Mudgayusha. Kulathayush, best for urinary stones. Kutajarishta for diarrhea. Takrarishta for indigestion. Kumari Asav, liver tonic. Kanaka Asav for the cough problem. Okay. Attasi Upanaha, Potasi. This is all things in the practicals you have to do. Then Malahara, cream, emulsions, you have to learn Jatyadi Grita, Tifala Grita, Bala Tail, Jatyadi Tail, medicated oils. Okay. Shodhana of Gugul and Hingu. Visit to the minimum 3 GMP approved Ayurvedic manufacturing units. This is record book, experiments, record book, journal, 10 marks, experiment 30 marks, spotting 20 marks, Viva 40 marks, total 100. Okay. Again, this is for Rasashastra and this is for Bhaishajya Kalpana. Okay. So, if you find this video nice, you are always welcome and you have requested to share my video, like this video, and I can do also the services like paid services, PPT as per demand, audios as per demand, and videos as per demand, you please WhatsApp me 9226810630. I wish you all the best, and please, please, please don't forget to subscribe my YouTube channel. I wish you all the best. Take care and bye bye. All the best. All the best, my dear friends. All the best.